How do I understand the gold staging system for COPD? Imagine trying to figure out how serious a problem is without a clear map. That's what the gold staging system does for chronic obstructive pulmonary disease. It helps doctors and patients understand how advanced the disease is and guides treatment. GOLD stands for the Global Initiative for Chronic Obstructive Lung Disease, which creates guidelines based on research and evidence. The system looks at three main things: symptoms, risk of flare-ups, and lung function. Symptoms are checked with simple questionnaires like the COPD assessment test or the Modified Medical Research Council Dyspnea scale. These ask about breathlessness, coughing, mucus, and how COPD affects daily activities. The risk of flare-ups or exacerbations is based on how often symptoms worsen or if hospital visits are needed because of COPD. Lung function is measured with spirometry, which tests how much air you can blow out in 1 second. This is called the forced expiratory volume in 1 second, or FEV1. The GOLD system groups patients into 4 categories: A, B, C, and D. Group A has low symptoms and low risk of flare-ups. Group B has more symptoms but still a low risk. Group C has low symptoms but a high risk of flare-ups. Group D has many symptoms and a high risk of exacerbations. These groups help doctors decide what kind of treatment you need. For example, someone in Group A might just need short-acting bronchodilators. Someone in Group D might requiring a combination of long-acting bronchodilators and inhaled steroids. Besides the ABCD groups, the GOLD system also stages COPD based on lung function alone. Stage 1, or mild COPD, has an FEV1 of 80% or more of what's predicted for your age and size. Stage 2, or moderate, has an FEV1 between 50 and 79%. Stage 3, or severe, is when FEV1 drops to between 30 and 49%. Stage 4, or very severe, is when FEV1 is less than 30%, or if you have respiratory failure. This combined approach makes sure treatment is tailored to both how you feel and how your lungs are functioning. Knowing your GOLD stay and group helps you and your healthcare team keep track of your disease. It also helps in adjusting treatments to keep your lungs as healthy as possible and improve your quality of life.